بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. دمان داودياشا تلفزيون كوين كلسن مقالة لندن فديوسيها مقالة لندن وحان إذن سلامينا إذن كسلامينا استوديو وين أقل كراون هاوس تلفزيون كلية هاي أنا قد الله السلام عليكم ورحمة الله دمانتين يريوين. sidii aad nooga barateen waxa aan macnaha idinkaga soo tabinaynaa hawada barnaamijkii qaaliga ahaa toddobaadlaha ahaa ku magac baxay Gurmad. barnaamijka oo ka baxa habeen kasta oo axada saacadu waa 8 fiidnimo waqtiga magaalada London, maalintu waa axad taariikhduna waa 20ka bisha December, bishan aynu ku jirnaa December. waxa awada barnaamijkan si gaar ah inoo marti ah dhakhtar isagu ku takhasusay cudurrada maskaxda gala. dhakhtarkaasi oo la yiraahdo Mohammed Zain Green Thompson. Dr. Thompson waa dhakhtar ku dhashay magaalada Durban ee wadanka Koonfurta Afrika. waxauna ku takhasusay cudurrada dhimirka ama maskaxda gala. asagoo ku sameeyay takhasuskiisa Cambridge iyo London ba. waxaan jeclahay inaad barnaamijka nagala qayb qaadataan su'aalaha iyo wax alaalay wixii afkaar iyo talooyin aad dhiibataan. waxaana ku dadaalinaa barnaamijka oo ku baxaya luqadda Ingiriisiga in aan qaybihiisa kala duwan idin u fududeyno dadka qaar inay fahmaan oo la socdaan barnaamijka annagoo isku dayayna inaan tarjunno waxyaabaha hadallada dhakhtarku ku hadlayo iyo tafaasiisha uu ka bixinayo xaaladaha cudurka maskaxda gala luqadda Soomaaliga. First of all, I have to welcome you again to
Thank
our
you.
program,
Pleasure to be back.
Carlson TV, and it's a pleasure to have you here.
Pleasure's mine.
Yeah. The first thing we would like to ask you is about the anxiety and how does it affect our health and well-being. su-aasha ugu horeysa oo dhakhtarka aan weydiinayo waxay tahay walwalka iyo sida uu walwalku u saameyn ugu yeesho caafimaadkeena guud ahaan. Please welcome. I would like you to explain the anxiety and how it affects our health and well-being.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه تسليما كثيرا بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. If those watching remember nothing but those few ayah from Surah Taha, the words of Musa alayhi salam, when he asked Allah, Rabbish Rahli Sadri, wa Yassir li Amri, oh my Rabb, open my chest and make my task easy. And then he went on to ask that Allah subhanahu wa ta'ala loosen his tongue and let them understand his speech. Then you will have understood the cause of anxiety and you will have understood part of the treatment of anxiety. But the reason that many of us struggle with understanding anxiety today is that the definitions are quite vague. So if you ask, as you did, to explain the nature of anxiety, in the medical literature, anxiety is a group of disorders. But the root cause of all the anxiety disorders, and we'll go through them one by one, is a fear which is disproportionate. So the person is aware that the fear is over the top, but they have difficulty in controlling it. Unlike psychosis, which we might discuss another day, where the person has the belief and they are certain that it is true. That is a delusion. But with anxiety, the person has a deep fear that is disproportionate and they're aware that it's disproportionate. Now, in terms of understanding the different types of anxiety, I think the simplest way is to say that there are anxieties which are generalized and some which are specific. So if we look at all anxiety disorders in total. In the West, we could say that perhaps over a lifetime, as many as 1 in 6 people might suffer from some form of anxiety disorder over their whole lifetime in the West. These numbers are lower in developing countries. But if we look at the generalized anxiety, such as generalized anxiety disorder, where the person has a sort of a free-floating anxiety for many different things. They're worried about their health, they're worried about their money, they're worried about their family, they're worried about things in general. If they have panic disorder, they have panic attacks, severe anxiety attacks, where they may have a racing heart, they may have their chest may feel tight, their chest is constricted. So what did I say at the beginning? Rabbi shrah li sadri wa yassir li am. So the person who has a panic disorder will feel as if their chest is closed, as if it is tight and as if it is heavy. They will have difficulty in breathing. And so Musa alayhi salam, we remember, was being asked by Allah subhanahu wa ta'ala to go and speak to Fir'aun. And he was asking Allah to open his chest and make his task easy for him. On the other hand, you have the more specific anxieties, like, for example, you could have a very specific phobia. The phobias are fears of specific things, like being afraid of spiders, arachnophobia. Yeah. You could have a social phobia. Yeah. And of course, there's some of the specialized types of anxiety which people from Somalia who are fleeing the civil war might be suffering from, including post-traumatic stress, for example.
Yes.
So those are the overall types of anxiety. As I said, the lifetime prevalence in the West for any of these disorders in total. But for generalized anxiety, it could be over the lifetime, say 1 in 25.
The phobias or the irrational fear or aversion to something. Can you explain that?
So if you have a specific phobia about spiders or about going out into public, into crowds, arachnophobia is a fear of spiders, and agoraphobia is a fear of going into crowds, going into the marketplace. So that's something more specific. But you also will have other phobias, you'll have other anxiety group disorders like post-traumatic stress, where there was something specific, some negative life event. Let's say seeing somebody being killed in front of you, let's say being in the Civil War, where that negative life event might later cause flashbacks, nightmares, being emotionally numb, irritability, difficulty sleeping, and this can cause problems. Now, in most cases, people with PTSD might, over the years, these symptoms might subside, but without targeted, without really facing the problem head-on, it can lead to a permanent change in personality due to the heavy burden of the anxiety.
Well, just when you look at the phobias, some people have fear, for example, swimming.
Yes.
Others have fear in being on, top of mountains.
Heights, yes, absolutely.
Heights, yeah. I think you also talk about, so can these things be dealt with and eradicated?
Yes, certainly. I mean, there are ways to attack them, but the first thing is to understand what is underlying them. And as I said, underlying them is a fear which is disproportionate. So when one looks at either a specific phobia or a very generalized anxiety, there's certainly medication that can help, but the medication is, of course, it's helping and it's treating symptoms as well. There's also talking therapy which can help. And when we spoke about depression, we spoke about the usefulness of cognitive behavioral therapy, the therapy which looks at your thinking and how it's impacting your actions. And CBT is also very useful for anxiety, and it's a good first-line treatment. CBT and or these medications which can help with anxiety as well.
For example, these things sometimes are overlapping.
Yes, so with anxiety, if somebody is diagnosed with that, many people with anxiety will have another disorder as well. Some of them might have a mood disorder such as depression at some time in their life. Somewhat fewer of them might have at some time in their life a substance use disorder, so not simply a problem with alcohol or drugs, but even with some other substance. For example, some people smoke very heavily when they become anxious, saying that the smoking is making them feel calmer. What they don't realize is that the chemicals that are in cigarettes and tobacco actually go into the brain and make anxiety worse. You might have a brief feeling of calmness when you smoke a cigarette initially, but the smoking is going to make the anxiety worse. So yes, there is an overlap between anxiety and some other disorders.
The issue, the post-traumatic stress disorder, is a form of anxiety disorder.
Yes,
and can develop after the person is exposed to traumatic events such as sexual assaults,
Yeah.
Events like traffic collisions, terrorism,
Yeah.
or various forms of threats on personal life. So I think, is it more common in any age, or does it affect children, adults the same way? Sometimes when we watch the news and
Yeah.
read about this type of mental illness, it is associated with war veterans
Yes.
more than anybody else.
I mean, generalized anxiety is generally considered to be most common in younger people between the age of 10 and 25. With regard to PTSD, it normally follows a significant negative event. And as you mentioned, sexual violence, including rape, and certainly up to about almost 2/3 of men who are raped, and up to almost half of women who are raped will develop some post-traumatic stress during their life thereafter. And childhood sexual abuse is very strongly correlated with post-traumatic stress. And we discussed it, as I said, you could have flashbacks, nightmares, emotional numbness, and other problems.
Dr. Muhammad Zain,
Yeah.
how damaging these flashbacks? How long are they likely to last?
Well, it depends what you do with them. As I said, in many cases they can resolve over the years, but sometimes with the permanent and not necessarily positive change in personality. So you want to try and face it head on. And there are many different, there's talking therapies, there's medication looking at the symptoms and trying to cut the cycle of what's going on. But we need to understand that with all of these disorders, including PTSD, the baseline, the foundation is that it is a fear which is disproportionate. And as with everything as a Muslim, we need to be very aware that even with these things, even if you're feeling that your heart racing in your chest and you say, well, this is something biological, I need medication, even if you're feeling the dizziness with the PTSD or the panic attack, even if you're feeling many of these physiological, changes to your body secondary to the anxiety, you must have the yaqeen to always start with asking Allah for help and asking Him for a way through it and asking Him for a way to make that fear of whatever that external event was, that memory of that past event, the fear of the spider or the generalized anxiety to subside. And for you, if you're going to have fear at all, fear Allah in a positive way and try and surrender to Him and ask Him to help you with overcoming the fear that you are having from whatever is causing your suffering. And again, as we discussed a couple of weeks ago, as Muslims, we begin by trying to have the best intention. So here you have an intention to become better and to not suffer, and you ask Allah to heal you. You try and do the best actions you can do, and this program we're trying to encourage people to do the best actions they can do amongst other things. But then afterwards, very importantly with anxiety, we need to focus on that tawakkul, that trust in Allah, after we've done all of the best things we can do and we've tried to do things with the best intention. Because if you can have that surrender, if you can ask Allah for help, if you can say, Rabbi shrah li sadri wa yassir li amri, if you can ask Allah to open your chest and to make your task easy for you, it is the biggest first step to trying to combat the root of the anxiety, which is a fear which is disproportionate. And any of the other things that you may or may not do, including medication and or talking therapy, is just going to be an extra action that you're doing and part of the means to which Allah is helping you.
Well, that's good. So in order to treat an individual of Muslim background suffering from one of these conditions, whether it is anxiety, whether it is post-traumatic stress disorder, whether it is phobias, beyond the therapy and medication, you highlighted the need for the Muslim to have good intentions.
Yes, that's
what do you think is exactly needed, for example?
Well, I think sometimes we become overwhelmed, and what we're trying to do is to dispel, through things such as this program, to dispel the ignorance. So you need to understand what anxiety is. It shouldn't be, because mental illness, I think you'll agree, sometimes people are afraid to even talk about it because they don't understand what it is. So when we explain what it is, it doesn't become the monster in the closet. It's something that's terrible but easy to understand. And when you understand what the basics are, you understand how to attack it. When you know your enemy, you can try and fight back against it. But the basics as a Muslim, in terms of trying to protect yourself from and treat yourself if you fall into anxiety are those basics, to really try and see what it is you're afraid of, to ask Allah to take that fear from your heart and try and turn to Him. But it doesn't mean at all that we don't use all the best treatments and medications and therapies available. But we don't do that expecting the therapy to be the thing that cures us alone, or the medication to be the thing that cures us alone. We ask our creations that He has given us to try and help us to do that.
Thank you very much. ase walaalayaal waad maqlaysaan dhakhtarka isagu ku takhasusay cudurrada dhimirka amba maskaxda gala ee cawada martida noogu ah barnaamijkeena Gurmad waxa uu ka hadlayay xaalado markaasi dadka la soo gudboonaada oo ugu horeyso anxiety-ga ama welwelka waxa kaloo ka hadlay phobia-ha ama cuqdada waxa kaloo ka hadlay post traumatic stress disorder oo asagu ah macnaha disorder amba maaragtay nidaam darro qofka ku yimaada kaasoo oo macnaha dhaca marka qofka uu macnaha toos uu exposed ugu noqdo xaalado khatara masalan ayadoo falal kufsi lagu sameeyo amba shil baaburu amba maaragtay argagixin ay dhacdo amba khatar ay ku timaado noloshiisa taas waxay keenaysaa wax la yiraahdo flashbacks qofkii wixii inay ku soo dhacdhacaan oo markasta noloshiisa caadiga ah ay xasuusto ay saameyn ku yeelato nolol caadi qofkaasi inuu yeesho marka waxa uu ka hadlay waxa ka muhiimsan ayuu leeyahay dhakhtarku daawada iyo therapy-gaba waxa ka muhiimsan qofka oo ilaahay weydiista in dhibkaasi uu ka saaro marka waxay la tahay inaad nagal qaadan doontaan xagga telefoonka su'aalihii aad doontaana dhakhtarka soo weydiin doontaan waa idin furan yahay Dr. Green Thompson, I would like just to ask a little bit about the use of therapy. What not many people know about how use of therapy can help mentally ill patient. Can you explain?
Well, as we spoke about cognitive behavioral therapy when we spoke about the treatment of depression, there are different types of therapy. Some are behavioral, some are different in the way in which they work. But CBT has good evidence for both depression and for anxiety. And it's helping you to really, with the help of the therapist, understand what your coping mechanisms already are, to understand what you're doing well and that is good to do, what you're doing that is good to do that you're not doing in the right way, and what you are doing in a very practice and automatic way that is not good to do at all. So if somebody's smoking to combat the anxiety, that's a coping mechanism, but that's obviously not a very healthy coping mechanism. The CBT with regard to anxiety would also help you in other practical ways in terms of teaching you, for example, distraction techniques that when the anxiety seems to be overwhelming you, you can try and do another fixed behavior to try and distract your focus from that anxiety. There will be other disorders for PTSD, for example, where you might know that if you speak to somebody who's reliving the trauma they went through, their eyes are darting around the room. Eyes are moving quickly. And there's some treatments which help the people really control the movements of their eyes while they're reliving that. And that helps to actually cut that cycle of that reliving of the trauma which causes them so much distress. So there are many different, quite interesting ways in which therapy can help to, at different steps along the process, cut the cycle of anxiety. Certainly in the UK and elsewhere, you go to your family doctor, your GP, and they would be able to either refer you for these talking therapies directly or to send you to a psychiatrist for further evaluation and treatment. And as a Muslim, as we said again when we spoke about depression, we make dua, as the Prophet ﷺ did, for an increase in ilm and knowledge which is beneficial. And if we are learning about how to understand our coping mechanisms and how to come up with different ways to distract ourselves to move forward, then this can be knowledge that's beneficial. And it may be that you listen to what the therapist is saying, and even if they give an example of one type of distraction technique, you might think of something that you're doing in your daily life as a Muslim in the course of your salah or your fasting or your zakat, which can also be used as a way to distract yourself from anxiety. And so, you can make the treatment part of your ibadah if you do it in the right way. Just one other point, I mentioned earlier that in the West, the rate of anxiety disorders is higher than in developing countries. And interestingly, we see that today people are often, even in a wealthy country like the UK, worried about money, worried about their family, worried about health. And they may feel forced, or they may feel that they are forced to do things which are haram. They open a restaurant and they're selling alcohol, or they want to buy a house and they go to the bank and they take riba. They do things that they know they shouldn't do. And again, again in Islam we're told, we think of in the years after Hijrah, when in the Quran Allah subhanahu wa ta'ala said that after this year, in the 9th year of Hijrah, the mushrikun would no longer be able to come to Masjid al-Haram. And some of the Quraysh were worried that they wouldn't be able to get enough money from this trade that they were getting. Allah subhanahu wa ta'ala replied in the Quran that if you fear privation, Allah subhanahu wa ta'ala can increase you from His bounty if He wills, and Allah is knowing and wise. So we need to remember that the word Muslim is to surrender, to submit to the will of Allah subhanahu wa ta'ala. And if we are falling into anxiety, or if somebody close to us is falling into anxiety, it's another opportunity to look at your life top to bottom and ask yourself, not to blame yourself, but just ask yourself quietly, what am I doing that I could do better? What am I doing where I'm knowingly not doing the best that I could do? What am I doing which may be harmful to me? And this difficulty could be a source of some goodness for you going forward.
Well, that's good. Well, sida la socotaan dhakhtarku wuxuu ka hadlayaa waa anxiety-ga ama welwelka, trauma, jahwareerka iyo phobias, cuqdada. Dad baa waxay cuqdad ka qabaan meelaha sarsare in ay amba fuulaan amba ay dul joogaan. Dad baa waxay cuqdad ka qabaan inay biyaha ku dabaashaan. Dad baa cuqdad waxay ka qabaan inay meelaha mugdiga ah ay galaan amba istaagaan. Marka waxaa kaloo jira anxiety-ga amba welwelka oo ah maaragtay cabsi iyadu qofku uu ka baqanayo, is a fear about a danger coming. qofku uu ka baqanayo khatar imanaysa, iyo troomaha oo ah jahwareer. Marka waxaasi oo dhan waxa uu ku nuxnuxsaday in dad muslim ahaana ay noo fududahay marka horeba intii aanan raadsan daawooyinka iyo maaragtay talking therapy-ga amba wada hadalka iyo wada xaajoodka iyo talooyinka mutakhasiska dhakhtarka ku takhasusay cudurrada maskaxda uu ku siinaya intii aanan daawo laga raadin, inay habboon tahay in ruuxu uu ku dadaalo inuu niyad wanaagsan la yimaado oo ilaahiisa weyn subxaanahu wa tacaala ee uumay uu weydiisto inuu dhibka ka saaro. taasi oo la isku geeyo ayuu dhakhtarku aaminsan yahay in natiijo keenayso. su-aalaha telefoonka khadka waa idin furan yahay, walaalayaal ku soo dhawaada. dhakhtarkana waxaa weydiin kartaan oo xalaale iyo wixii ku saabsan mawaadiicdan muhiimka ah laga hadlay. Dr. Thompson, not many people like to admit that they have a mental condition, educated or uneducated, black or white, Muslim or Christian. People in many parts of the world are very reluctant to admit that they have a mental condition, and they try to live, to hide their conditions even from their loved ones. Have you come across to that experience?
Absolutely, and within the Muslim community, sometimes the things which should be bringing us peace and should be bringing us contentment and should be bringing us help, such as the Quran, are misunderstood by Muslims, and sometimes they are punishing themselves through their misunderstanding. So people who are Muslims who suffer from difficulties may hear other people say to them, as we said a couple of weeks ago, that you're obviously a bad Muslim or you have no faith, this is why you're suffering. And this is a false way to understand things. As we said before, in the Quran, Allah subhanahu wa ta'ala said that it is He who gives laughter and tears.
Yeah, we have got a caller. Please welcome. Walaal soo dhawaad.
Assalamu alaikum.
Alaykum assalam. Walaal soo dhawaad. Codkaaga sare u qaad. Waxaan ku leenahay ku soo dhawaad barnaamijka Gurmad.
Walaalo magacaygu waa Nadiifo.
Nadiifo, walaal soo dhawaad.
Waxaan qabaa arthritis. Marka cudurkaas inaan ka leeysana u maleynaa macnaha waxa la ii diray meeshiina ma aadin. Marka lug baa marmar i xanuunta. Dhakhtarka ma ii weydiin kartaa?
Okay, the caller is a sister, and her call is related to arthritis. She said, I sometimes feel pain in my leg, and I've been referred to a place which he didn't mention. Can you ask the doctor if he could advise me anything? We are dealing with mental illness, and the question just came.
I'm not quite sure if it's arthritis related to anxiety or arthritis related to arthritis.
It is arthritis,
Okay.
the question.
Well, given that I'm a psychiatrist, I'd probably better not give the sister advice on arthritis. What I would say to the general audience is that one thing I didn't mention is that sometimes when one has severe anxiety and other mental disorders, it can sometimes present actually almost with physical pain or physical symptoms. So you could have somebody who actually presents with severe pain, or even in some cases weakness, or somebody might even think that they have a stroke or another condition, and in some cases that can be due to just emotional stress overflowing and affecting the brain, and so they present to the GP or to the neurologist with weakness or with joint pain or with other things, and that is certainly something that we see. But if this is a case of just plain and simple arthritis with no mental health component, it's probably safer for me not to comment on it.
Okay. dhakhtarku wuxuu hadal dheer ayuu ka hadlay, wuxuu ku soo gaabiyey walaashaana soo wacday, waa dhakhtar cudurrada maskaxda, marka waxay lama habboona in aan ka bixiyo jawaab arthritis-ka ma aha majaalkaygii, ma aha wax markaasi aan ku takhasusay oon ka hadli karo, laakiin waxaa dhici karto yidhi marmar in xanuun jiro, xanuunkaasi oo isu bedeli karaa mid physical ama jismiga saameyn kara. marka waxay la tahay markas walaasheen in ay haddii ay su-aasheedu ku koobneed arthritis, aynan dhakhtarkani unan markaasi wuxuu ku kooban yahay cawada inuu ka hadlo cudurrada dhimirka. waana mahadsantaa walaal. waxaa ku jira ruux kale ayaa ku jira khadka telefoonka. walaal soo dhawaaw.
waan dhawahay.
magacaaga iyo meeshaa ka soo hadlaysa walaal.
asalaamu calaykum, waa hooyo Soomaaliyeed oo London ka soo hadlaysa.
walaal soo dhawaaw hooyo.
waxaan doonayay inaan ku weydiiyo, waxaan ahay dadka negative-ku ku badan yahay.
sax.
marka wax haddii aan qabanayo waxaan isoonayaa bilow xagga kale khaldan ama negative-ka uu dhacaa, marka maxaa tala waxaa keeni kara, maxaase lagaga bixi karaa?
waa mahadsan tahay. markaad tidhaahdo negative-ka ku badan yahay, macnaha ma waxaad aaminsan tahay wax kasta ood samaynaysa inaynan guul keenin ama natiijo imaanin? sidaa ma aaminsan tahay?
مثلا عروضه كله هدان ديرون إسلام ميلها تجان بالله وحكوسه دعام بان صورنا يا وحي وحول بحق وحنو بلا نيجاتيفك.
Okay, yes. وما هتسنتها ولا خد كان نوجد جريسة and the caller is another sister. She said there are two types of people. Means optimistic and pessimistic. She said I always have feeling of pessimisticness. She said I'm more pessimistic person, and for example, if I send my children to somewhere, I always think of something might happen to them. So there is a feeling of negativeness about many things in life. So what does the doctor think about this, and is it something that needs medical professionals to draw attention to?
Well, firstly, I wouldn't want us to say that there are two types of people, optimistic and pessimistic, in the sense that we say that this is the way the people are and that's the way it is and they can't change. One can have an optimistic outlook, a positive outlook, and a believer should strive to try and have a positive outlook. Or one could have a negative outlook and think that bad things are going to happen, and that is something that we should try not to do. Because with everything we should do, we should say, whether you're sending your children to school or you are going to work yourself, Bismillah, do it in the name of Allah subhanahu wa ta'ala, and have good intentions, as we said, do the best you can do, and leave the outcomes to Allah subhanahu wa ta'ala, and trust in Him. And that way a believer is supposed to be able to cope with both good things and bad things. That it doesn't matter what your condition is. If you're given good, you have shukr. If you're given difficulty, you have sabr, you have perseverance and patience. But don't allow the negative outlook to come into you, because as Yaqub alayhi salam said, no one loses hope of the mercy of Allah except the qawm al-kafirun. So we should never feel that there's no hope. We should never feel that Allah's mercy is not going to come to us. We have no knowledge of the future, so we cannot say that. And we should always have hope of the mercy of Allah and try, all of us inshallah, to be more positive.
waxuu kugu soo koobay hadalkiisii dheeraa dhakhtarka, waa kulligan waxaa nagu waajibaa in aan noqono kuwo markaasi u fakara si positive wax wanaagsan samey ilaahayna khayr ka rajay markastana ilaahay xasuuso laakiin waa iska dabiici in ay jiraan labo dareen midna ah maaragtay pessimistic qof isagu markaasi nolosha un ka arka wax kastoo dhacayo walwala oo u haystay in khalad dhacayo iyo qof maaragtay sida kale oo wanaagsan u arka marka wuxuu ku leeyahay wax wanaagsan sameey ilaahayna ka rajay khayr waa walaalayaal weli waxaan dhexda kaga jirnaa barnaamijkeenii gaarka ahaa ee aan kaga hadlaynay cudurrada maskaxda gala caawana waxaa barnaamijka inoogu cazuman dr moxamed zayn green thompson oo ah consultant psychiatrist oo cambridge city kuna takhasusay cudurrada maskaxda dhakhtarkani dhalasho ahaan waa wadanka koonfurta africa wuxuu ku dhashay oo ku koray magaalada durban halkana waa uu ka shaqeeya waa dhakhtar weyn oo aada loo ixtiraam if we look about the issues the phobias and the people having irrational fear if the person starts to develop these kind of irrational fears not only about one thing but about many things can that be categorized as mentally ill person?
Well, anxiety is certainly a type of mental illness, but again, we should see these things as Muslims as tests. It is He who gives laughter and tears. Allah subhanahu wa ta'ala can give us times when things are and we may be in periods of difficulty. And, you know, if we look at that great generation of the Sahaba, they had people attacking them from all around them. They had munafiqun, hypocrites in their midst. They were not wealthy at the beginning, and they had greater reason to worry than we do. And if we remember that beautiful example of Abu Bakr Siddiq radiallahu anh, when he and the Prophet of Allah sallallahu alaihi wasallam were making hijrah to Medina and they had to hide in the cave while they were fleeing the Quraysh, Abu Bakr Siddiq later in life said that on that day he was worried, and the Rasul of Allah said, what do you think of two people when Allah is the third? And Abu Bakr Siddiq is said to have said later that after that day he didn't worry, he didn't have fear, he didn't have stress and anxiety in his life. He had been through that experience, and for the rest of his life he was free of that. Now we know that Sahaba are the greatest of generations, and we may not feel that certainly any of us individually are at that level, but this is what we should be striving for. We should be striving to go forward and do the best we can do. Wherever you're living, whether you're living in a war zone or in a place of peace. And indeed, it's in the wealthy places of peace in the West that there's higher anxiety than in the poorer places. And try and do our best, have good intentions, leave the result with Allah, whatever that is, and know that in this life or the next, there'll be goodness for us. And the thing is, when we spoke about CBT earlier, cognitive behavioral therapy, I was explaining how it uses logic and it helps you to do a clear audit of your coping mechanism. Now, as a Muslim, you've got an extra level of logic where you know that this world is not all that there is, that the akhirah is to come, and what is to come is better than what we have here. And we should not be those who, when we are asked to do something difficult, when we're asked to strive in the path of Allah, we should not be those who are clinging heavily to the earth, who are worried, who are trying to stay close to our wealth or to our families or look after our health. We should try and do the best that we can do, even if we think that there is some difficulty. And certainly Allah will reward you for your intention and for your action. And the end is with Allah subhanahu wa ta'ala.
Just Dr. Kawariyal wuxuu ka hadlay oo tusaale u soo qaatay saxaabadii wuxuu yidhi ma aynan ahayn kuwo markaasi qani ah oo maal haysta fuqar ay u badnaayeen wuxuu kaloo ka soo hadlay in ay jireen kufaar iyagu ku duulaana oo dagaal kula jira oo kaga imanaya banaanka iyo munaafiqiin gudaha kaga jira oo ayagu markaasi dhibaatooyin kaga hayay waxa la yiraahdaa enemy within cadow gudaha ah marka wuxuu leeyahay waxay lahaayeen asbaab badan oo ay u baqdaan oo ka badan anagu maanta waxa aan sheeganaynay in ay baqatin ugu abuurayaan marka waxa ay ku guuleysteen uu leeyahay in ay niyadooda khaalis uga dhigeen eebe iyo diintiisa macna marka anagana wuxuu ugu waaninayaa dhakhtarku wixii aan hore buu ogeynayo mar labaadna xasuusinaya oo ah qofku dhib kastoo soo maraa in uu mataqaanaa intentions ama niyad wanaagsan la yimaado Doctor, I think the anxiety has various stages, and we sometimes see people who are at the very end of this condition, and it may be too late for professionals to help. So can you tell us the various stages and the stage where it is too late, and sometimes people commit?
It's never too late.
Never too late.
Never too late. So, you know, we never lose hope of the mercy of Allah subhanahu wa ta'ala. Certainly, the things that one does, if you allow the anxiety to be your master and you listen to the anxiety, you are going to avoid things. You are going to avoid things that remind you of the stress that you had, which caused the post-traumatic stress. If you have a specific phobia, like a fear of spiders, you are going to absolutely avoid spiders. If you're afraid of heights, you're going to avoid heights. Now, interestingly, obviously, as we said, as a Muslim, you should have good intention, good action, just try and go forth and do what you need to do and trust in Allah. If you were to go to a therapist and ask them for treatment for some of these problems, they would be telling you to do the opposite of what the anxiety is telling you to do. So some of the treatments for being afraid of a specific thing, such as spiders or heights, for example, would be to gradually expose yourself to that thing. So the therapist might show you a
living spider.
Well, no, Brother Sahel, if you were afraid of spiders, I wouldn't be so nasty to show you a living spider. I would show you a picture of a spider, a picture of a small spider, and I would put that picture at the other end of the room. Then maybe we would show you a rubber spider, a small rubber spider.
We just sorry to cut you off. We got another caller. Please welcome.
Hello.
Assalamu alaikum. Please welcome.
Alaikum assalam wa rahmatullahi wa barakatuh.
Malafiyanya.
Alhamdulillah, wala magacaygu waa Xuseen, waxaan ka soo hadlayaa waddanka Denmark.
Xuseen, walaal waa soo dhaweynayna.
Walaal su-aashaydu waxay tahay dhakhtarka waxaad ii weydiisaa maaragta hurda yarida ama hurdada uu qofku waayo maxaa keena. Taa waxaan ku darayaa oo kale matalan qof markuu sariirta tagay uu damco iyadoo hurda hayso inuu seexdo, haddana kabuubyo dareemaya, xagga qadaadka ka dareemaya, dabadeed kabuuyadaa siduu u mastaajeynaya ama u taataabanayo ku mashquulay hurdadii kaga tegayso, bal maxaa dhakhtarku waa ninkaa kula talin lahaa?
Okay, yes, the caller is a brother from Denmark.
Assalamu alaikum.
Alaikum salam. He put two questions across to you. One is less people who sleep less than usual, and what are the causes? What is causing people to normally lose, not to sleep enough?
I mean, that's
and I think the other question is that, as I understood what he highlighted, is feeling of numbness at the back of the head.
Yeah.
He has these two questions.
So, disturbance of sleep, whether you're sleeping too much or too little, can be a feature of anxiety-related illness. But as we discussed previously, it can also be a feature of low mood. Emotional numbness would more usually be associated with anxiety disorders, although both of these are fairly non-specific complaints, so they could be part of one of a range of problems. And so what the brother would need is for somebody to take a much more detailed history, to look at all of his symptoms, when they started, what seems to have caused them, what he's doing to try and help himself, to try and come up with the clearer diagnosis. But certainly with anxiety group disorder, disturbance of sleep, emotional numbness, irritability are all common features of anxiety. But they can be features to varying degrees of other problems as well.
دكتورك walaalkeena ka soo hadlaya Denmark waxa uu ku leeyahay uu kugu jawaabay su'aashaadii ahayd hurdada oo la hudo in ka yar intii caadiga ahayd waa nooc ka tirsan anxiety-ga ama walwalka laakiin waxa uu hadalkiisii nuxurkiisu ahaa waxaan u baahanahay detailed history taariikhda xaaladani oo kooban ayaa loo baahan yahay si goorta ay bilaabatay ay kugu bilaabatay sida ay ku macnaha waqtiyada ay soconayso iyo wixii la mid ah sida ay ku saameynayso marka waxa kale oo ka hadlay the numbers at the back of the head. What was your answer?
Again, it's a very general symptom, and so I wouldn't want to say that it equals something specific. somebody needs to take a more detailed history from the brother to try and clarify. Just a couple of general words about sleep, though. Besides medication and other therapies, regardless of the reason that somebody is struggling with poor sleep, there are a few things that you can do to try and see if you can help improve your sleep yourself.
waxaa jira waxyaabo qaar ayuu leeyahay dhakhtarku oo kugu gargaaraya in aad mataqaanaa hagaajiso hurdadaada. And what are these?
So one of the things you can do is try and have a reasonably regular time that you go to sleep and a time that you wake up. Now, happily, as a Muslim, if you are trying to pray your 5 times salah within the waqt, you're going to go to sleep sometime after Aisha, and you're going to wake up in time for Fajr, inshallah. And if you try and do that on a regular basis, you're going to be training yourself to try and have a regular sleep-wake cycle. Importantly, during the day, obviously if you're living in a very hot country, as Sahaba did, you might have a short nap after Dhuhr in the heat of the day, but that's still very short. But you're going to try not to sleep for hours and hours during the day, because people who say they're not sleeping well at night, they'll be exhausted during the day and they'll find themselves napping off for several hours during the day, maybe even missing their salah. But even if they don't miss their time of salah, they're sleeping during the day, and their body then knows that it's going to get rest during the day, and then at night you're tossing and turning. A second thing is that you can try and avoid things at night which are going to make your mind overly active. So if you are drinking tea or coffee and you've got a sleep problem, you should try and reduce your caffeine intake from tea, coffee, or any fizzy drinks, and definitely don't take any caffeine at night. If you are smoking, for example, nicotine is also making your mind overactive. If you've got any anxiety problem or sleep problem, you should try and stop smoking completely. In fact, you should try and stop smoking completely regardless of whether you have a problem or not. But certainly if you cannot do that in the short term, you should make sure you're not smoking at night. Thirdly, you should try and look at your bedroom and make sure that it's not very cold and drafty, or it's not too hot, that the temperature is comfortable. And that it is a place where you're not going to be disturbed after you fall asleep, that will make your sleep disordered.
Definitely. walaalka naga soo cadeen marka dhakhtarku waxa uu sheegay 5 shay oo markaasi wanaajinaya hurdadaada. waxa uu sheegay in ay wanaagsan tahay sleep cycle-kaaga ama qaab hurdeedka inaad ka dhigto mid markaasi waqti go'an bilaado, macnaha uu dadka markaasi sida muslimka markii uu tukado cishaha uu markaasi isu diyaariyo inuu hurdadii galo, salaada fajrkiina ka kaco. marka waxa kale oo leeyahay haddii maalintii aad hurdo taqiinay iska yaray, waayo waa inaad yeelataa hurdo kooban oo aan saa u badnayn inda guduudsiga dadka qaar u yaqaanaan, waayo hadda hurdo dheer gasho waxay saameynaysaa habeenkii. midda kale wuxuu ku leeyahay haddii aad cabto kafeega ama shaahiga, asagana habeenkii iska yaray ama iska wada jooji. haddii sigaar jiro ama smoking uu jiro, waxay tahay taasina inay meesha ka baxdo. wuxuu ugu dambeyn leeyahay eeg qurfada qolka aad jiifato, haddii markaasi uu yahay mid aad u qabow ama mid aad u kulul, waa inaad ka dhigtaa meel markaasi dhexdhexaada. waxyaabahaasoo dhan iska jeegreeyo dhakhtarku ku leeyahay. waxaa jira qof baa ku jira khadka. soo dhawa walaal.
السلام عليكم.
عليكم السلام ولا
عليكم السلام.
ولا أنا وش دولة دكتوركم مين ليه ولا على سوى النقران كنا قصة.
يا ولا
واحد من دولة ولا على محفظة دكتوركم مين ليه لوجينا دو محفظة أحد لوجينا دو جميل ميكو حيستان عبد السلم بركيس عن ثلاث قرنا ولا على.
she's asking.
مال ودكتور مو لو تقوم مين ليه ولا على.
وكو الدنيا ولا and the sister. Are you calling from London? Sister is calling from London. She said she wanted to know if you have a place where this sister and her family or others can visit you.
Well, as we discussed before the show today, I work full-time for the NHS, and I don't see patients independently, but that we discussed again earlier today that as a community we ought to see whether we can identify a network of Muslims working in psychiatry and the field of mental health in general, whose details can be made available to the community at large, and that's a project that we'll have to work together on.
Well, mahadsantahay haddii aad maqlayso. dhakhtarku waxa uu yiri waxaan full time ugu shaqeeyaa NHS-ka, markaasi ima suurtagelayso shakhsiyan in aan markaasi dhibanayaal ama dad markaasi xanuunsan aan macnaha la kulmo anigu shakhsi ahaan. laakiin maanta ayaan ka wada hadalnay sida suurtagal ay u tahay ciyaado ama clinic markaasi asagay dhakhaatiir kale gabar kalea jirta iyadana mutakhasusada cudurrada maskaxda oo muslimada bal meeshaasi haddii aan abaabuli lahayn clinic marka waa mashruucu gacanta aan ku hayno waana kula soo socodsiin doonaa insha allah waxaa jira dhowr dhakhtar oo jecel inay dadka wax u qabtaan waxaan jecelnahay in aan bal macnaha aan dadka ka dhaadhicno in xanuunka maskaxda ruux kasta ay dhici karto inuu xaaladii ay hayso wax ceebana uunan ahayn qofkuna ay waajib ku tahay in uu la tacaalo oo u raadsado xalkuna wuxuu yahay waa daawooyin iyo wada hadal uu kula yeelanaya nimankan ku takhasusay oo ayagu qaar meelaha qaar ku xaliya mashaakilka hadal iyo wada xaajood waad arkaysay hurdada ninkaasi hurdo la-aanta uu ka hadlay inta meeloodoo dhakhtar ku taabtay oo laga yaabo in ay keenayaan hurdo la-aanta marka waxaan ka wada hadalnay bal hadday suurtagal tahay in clinic la helo ama qaab bulshadu uga faa'iidaysato waana walaal gacantaan kula jirnaa t v-ga ayaan ka soo iclaamin doonaa haddii ay najaxdo waxaan soo gaarnay dhammaadka barnaamijka waxaana jecelnahay inaan idinkaga mahad celino sidii qiimaha iyo qaayaha laheed oo uga qayb qaadateen barnaamijkan waxaana uga mahad celinayaa dhakhtarka moxamed zayn green thompson oo noogu yimid booqashada stuudiyaha calson t v asaga oo walaalihiisa u sharxay ugana hadlay waxa markaasi asagu eebba baray oo ah cudurrada dhimirka iyo sidii markaan loola tacaali lahayn I have to thank you for coming to Calson TV once more, and it was great privilege to have you on this program.
The pleasure is mine.
I think may Allah reward you for everything that you have said and your efforts. Means that you are trying to help your brothers and sisters. I think the question that has come across to you is that the need for the community to access their own brothers and sisters in this field because their mental illness is an issue, and we want to come out into the open and deal with it. And that's what is your concluding statements?
I think my concluding statement would be that as with all things, and certainly in this field, we need to return to the Quran and the Sunnah and ask Allah for help in all things. Have yaqeen in all actions of our life that we try and do things in a way which Allah subhanahu wa ta'ala is pleased with us. And where we run into difficulties, to know that this is a test from Him and say to Him, as I said, as Musa said, Bismillahir Rahmanir Rahim, Qala Rabbi shrah li sadri wa yassir li amri. And if we can do that, inshallah, we may be of those who are successful.
Thank you very much. Walaalayaal waa mahadsantihiin waxaan idinkaga tegaynaa amaan alla iyo amaan rasuul iyo kulanti dambe oo xiise leh waxaana rajaynaynaa in ilaahay naga dhigo kuwii ka faa'iidaysta waqtigooda una faa'iideeya walaalahooda marka barnaamijkani waa barnaamij qiimo leh ilaahay intii xanuun hayo oo dhimarkan allah ka saaro inteena kalena caafimaadkeena allaha inoo xoojiyo marka waxay la tahay caruur fara badan oo iskuulaad ka dhigata ayaa la sheegayaa inay mental illness amba xanuunku dhimirku jiro dad fara badan oo naga midana waxaa iska haysta xaalado kala duwan marka ceeb ma ahan qofku inuu raadiyo xal waxaa mahad u soo jeedinayaa maamulka telefishinka Calson markasta iyagu fududeeya in barnaamijkan Gurmad uu baxo bidon shuruud awada waxaan si gaar ah ugu mahad celinayaa technicianka Cadaawe oo laantii barnaamijku uu sidan quruxda badan u baxeen intaan iska arkayno usbuuca soo socda وداديها برنامجك وياهي دعاء يوسف وحان إذن الله هاي أمان الله يا أمان الرسول والسلام عليكم ورحمة الله.
وعليكم السلام ورحمة الله وبركاته.